well, because with adolescents, they're not old enough to utilize these substances. But it's overuse or misuse of a substance, and especially for adolescents, it's any substance that they're not prescribed medical. But typically, when we think co-occurring, it's mental health and substance use disorders. It's the same thing. The term has kind of transferred over time, but co-occurring is the same thing as dual diagnosed. It depends on the level of care the client needs. Sometimes it can be treated on an outpatient, like through talk therapy, um, and working through with adolescents, working through the family and trying to rebuild some of those relationships. Then they may have to do a residential stay for a period of time that might include detox, and that could include, which also would include the talk therapy and group therapy. Um, in addition, depending on the type of substance the client was using, there might be some medication treatment along with that. So that could be for somebody that has a dual diagnosis, or that has a recently diagnosed mental health disorder, making sure they're on the right medications that work for them, um, or somebody that maybe has a substance use disorder as well. Then there's medications that we provide for those as well. So that's kind of like what came first, the chicken or the egg type thing.
Right.
Whenever you have adolescent clients, typically there is some sort of mental health issue that goes along with that. So I like the term co-occurring because a lot of times they happen at the same time, because especially for talking older adolescents, that's when those mental health issues really start to kick in. Before somebody's diagnosed with a mental health disorder, typically people or the assessors like to look at it and look at them how they were when they were maybe using the substance or withdrawing, versus after a period of time before they'll make a definitive diagnosis. I've been doing this for almost 16 years now. So, I mean, recovery is possible regardless of age. And just because there's a mental health diagnosis or a substance use diagnosis doesn't mean that somebody can't move forward with their life with it. And